You ever catch yourself in a spiral of thoughts that just, well, don't feel good?
Hmm.
Like your emotions have sort of grabbed the steering wheel and are taking you on a bumpy ride?
Yeah, I think we all know that feeling.
Well, today we're strapping in for a deep dive into something that might just give you a map, maybe even put you back in the driver's seat of your own mind. It's cognitive behavioral therapy, or, CBT.
Exactly, CBT. It's really become a cornerstone in understanding how our minds work.
Okay.
And it's based on a pretty fundamental idea that there's this powerful connection between our thoughts, what goes on in our heads,
Right.
how we feel because of those thoughts, and then ultimately what we do, our behavior.
So they're all linked.
Absolutely. And often those negative thought loops, they can really fuel negative emotions
Yeah.
and kind of lead us down paths we'd much rather avoid.
Okay, so it's not just some random feeling popping up. There's usually a thought, maybe one we don't even notice, that kicks things off. And that then affects our actions.
That's the core idea. Like if you think, oh, I completely messed that up, that thought might trigger feelings of anxiety or shame,
Yeah.
which then might make you want to avoid similar situations entirely next time.
Okay, that makes sense.
And while, the mind-body connection isn't exactly a brand new concept,
Sure.
CBT, particularly the way Aaron T. Beck developed it back in the 1960s, really structured this into a practical kind of step-by-step method.
Structured, okay.
And what's really key to remember is that CBT is typically quite focused. It's usually not this long-term wandering exploration. It's more goal-oriented.
Right, so figuring out specific problems.
Exactly. Identifying specific problems and developing tangible ways to tackle them.
Focused and practical. I like the sound of that. So if we're looking under the hood of CBT, what are the core mechanisms? What makes it tick?
Well, one of the real engines, I'd say, is what we call cognitive restructuring.
Cognitive restructuring.
Yeah. And what's fascinating here is the process. First, it's about becoming aware of those automatic thoughts, the ones that just pop into our heads, often without us even realizing it.
Those little background thoughts.
Precisely. And once we can spot them, the next step is to really kind of put them under a microscope. Ask, are these thoughts actually true, rational? What's the evidence for them? Is there maybe another way, a more balanced way, to look at this situation?
Okay, challenging them.
Exactly. The goal is to trade in those unhelpful, often distorted thoughts for ones that are more balanced and, well, rooted in reality.
Like weeding a garden.
That's a great analogy. Think of those negative thoughts as weeds. CBT helps you identify them, question if they should even be there, pull them out by the root, and then cultivate more positive, nourishing thoughts instead.
Okay.
It's this active process of questioning and replacing that really leads to lasting change.
So that example you gave, or maybe like if someone spills coffee on their notes right before a big presentation, and their first thought is, disaster, I'm going to bomb this. That's the weed.
Yes, the weed, exactly. Now, using cognitive restructuring, they might challenge that thought.
How?
Well, they'd ask, okay, is it really a disaster? What's the actual evidence I'm going to bomb? Haven't I recovered from small setbacks before?
Right, looking for evidence.
What's a more realistic perspective? Maybe, okay, this is annoying, definitely annoying, but I can probably still read most of it, and I know my material well enough anyway.
Okay. That shift.
That small shift in thinking can make a huge difference in how they feel less panic, maybe, and how they actually approach the presentation.
So changing how we think. But you also mentioned our actions are important too.
Absolutely crucial.
So tell us about this behavioral activation. It sounds active.
It is, because, you see, when we're feeling down or anxious or overwhelmed, our natural instinct can sometimes be to withdraw.
Yeah, pull back, hide away.
Right. Stop doing things we usually enjoy or find meaningful. But CBT recognizes that this inactivity itself can actually trap us. It can make our mood worse, creating a negative cycle.
Okay. The less you do, the worse you feel, the less you want to do.
Exactly that cycle.
Yeah.
So behavioral activation is about intentionally scheduling and engaging in positive or meaningful activities,
Yeah.
even if you really don't feel like it at first.
Even if motivation is zero?
Especially then, sometimes. It's about getting that positive momentum going again, kicking things into gear.
So if someone's feeling really low, maybe stopped seeing friends, stopped going for walks, behavioral activation would be like gently encouraging them to pick just one small, maybe even tiny, enjoyable activity.
Precisely.
And just commit to doing it, even if it feels like a massive effort.
Yes. Even something seemingly simple, like listening to one favorite song or stepping outside for just 10 minutes. It can start to shift things. It's like jump-starting a car battery. You need that initial spark.
Got it.
Okay.
So we've got changing thoughts, changing actions. What else?
Well, another key piece is skill building. CBT isn't just about tweaking thoughts and behaviors related to a specific problem. It's also about equipping people with practical tools.
Tools for life, kind of?
Exactly.
Mm.
Tools to navigate challenges more broadly.
What sort of skills are we talking about?
Things like effective problem-solving strategies, how to break down big problems, practical stress management techniques you can use in the moment, relaxation exercises, deep breathing, mindfulness, that sort of thing.
Things you can actually do.
Concrete skills, yeah. Things individuals can learn and integrate into their daily routines so they feel more prepared, more equipped to handle whatever comes their way.
That makes sense.
And then there's something that might sound a bit like school. Homework assignments.
Homework. In therapy. Seriously.
Yeah. But it's not about grades. It's actually a really vital part of making CBT effective.
Okay, tell me more. Why homework?
Well, between the therapy sessions, individuals are often encouraged to actively practice the techniques they've been discussing and learning. It might involve keeping a thought journal, tracking thoughts and feelings in certain situations, or trying out a specific relaxation technique when they notice they're getting stressed.
Yeah?
Or maybe even intentionally trying a small behavioral activation task, stepping slightly outside their comfort zone to practice coping skills in a real-life scenario.
So taking it out of the therapy room.
Exactly. It reinforces the learning. It helps bridge that gap between talking about change and actually living the change. It's like practicing scales. If you're learning piano, you need the practice for it to stick.
Right, makes sense. It's not just theory, it's application. Okay, so bringing this all together, what does a typical CBT session actually look like? What would someone expect?
Generally, it's designed to be very collaborative. It's a partnership.
Between the person and the therapist?
Yes. Right from the start, they'll usually work together to clearly define specific, measurable goals. What does the individual want to achieve?
Okay, clear goals.
Then the sessions involve exploring those patterns of thought and behavior that seem to be getting in the way of reaching those goals using the techniques we've discussed.
Cognitive restructuring, behavioral activation.
Right. And the emphasis is really on finding practical solutions to current problems. While the past is acknowledged, CBT doesn't typically involve, say, years of deep diving into childhood experiences unless it's directly relevant to the current issue. It's more present focused.
Practical solutions now.
Yeah, okay.
You mentioned social anxiety earlier. How might that play out in a session?
Right. Good example. So someone with social anxiety, their core fear might be perhaps a deep worry about being negatively judged.
Yeah, very common.
So the therapist would help them examine the evidence, what really supports that fear, and just as importantly, what evidence contradicts it. Are there times they weren't judged negatively?
Challenging that core belief again.
Exactly. Then a big part might involve what's called exposure therapy, but done gradually.
Exposure. Sounds scary.
It can be, which is why it's done step by step, collaboratively. Starting with less intimidating social situations, maybe just making eye contact, then perhaps a brief chat, slowly working up to more challenging scenarios.
Okay, gradually building confidence.
And throughout this process, they'd be actively using the coping skills they've learned, maybe relaxation techniques beforehand, or challenging negative thoughts as they happen in the situation.
Using the tools in real time.
Precisely. The aim usually isn't to eliminate anxiety completely. That might not be realistic or even desirable, but to learn to manage it effectively so it doesn't control their life.
Okay, that makes sense. Manage it, not necessarily erase it. And you mentioned earlier the typical course might be around 5 to 20 sessions. That sounds quite efficient.
It often is, and that's definitely a hallmark of CBT and a significant benefit for many. It's designed to be focused relatively short term.
Compared to other therapies, maybe?
Potentially, yes. And speaking of benefits, there are quite a few reasons CBT has become so widely used and, frankly, respected.
Like what?
Well, for one, as we touched on, it's evidence-based. There's a huge amount of research, numerous studies, consistently showing it's effective for a wide range of difficulties.
So science backs it up. It's not just theory.
Correct. Solid scientific backing. And the fact that it's typically short-term and goal-focused can be really appealing for people looking for tangible progress on specific challenges.
Right, they want to see results.
And I think what's really empowering about CBT is that it gives people concrete tools and skills, things they can keep using on their own long after therapy ends.
Fostering independence.
Exactly. It's about building self-reliance, giving individuals a sense of agency, more control over their own mental well-being.
That's huge. Learning skills for life. And you also said it's quite adaptable.
Very adaptable. It's not a rigid one-size-fits-all approach.
How so?
It can be delivered effectively one-on-one in traditional individual therapy. It works well in group settings, too, where people can learn from each other.
Oh, interesting. Group CBT.
Yes. And increasingly, it's available through online platforms, apps, and even self-help books and workbooks.
Making it more accessible.
Absolutely. That adaptability really broadens its reach, making it available to more people in different circumstances.
That accessibility is definitely a plus. Now, we've mentioned anxiety, depression, social anxiety. What other kinds of issues has CBT been shown to help with?
Oh, the range is actually quite impressive based on the research. It's shown positive outcomes for things like specific phobias, fear of spiders, flying, etc.
Okay.
Post-traumatic stress disorder, PTSD, generalized anxiety disorder, or GAD, panic disorder, obsessive-compulsive disorder, OCD.
Wow.
It's also used successfully for eating disorders, helping people with substance use problems, and even for things like chronic insomnia.
Insomnia, really?
Yes, CBT for insomnia, is actually a first-line treatment for chronic insomnia, focuses on sleep-related thoughts and behaviors.
Huh. That's a really broad spectrum then. It sounds like those core principles, thoughts, feelings, behaviors, skills, are just really widely applicable.
They really are. And what's also interesting is seeing CBT principles integrated beyond therapy settings.
Like where?
In schools, for example, to help students build emotional resilience. In workplaces for stress management programs. Even in general healthcare settings to support patients dealing with chronic illness, for instance.
So the ideas are spreading.
Yes, that focus on providing practical strategies for managing thoughts and emotions seems to have really wide relevance.
Okay, so let's try and wrap this up. We've taken a pretty thorough deep dive into cognitive behavioral therapy today.
We have.
We've looked at that core idea, the powerful link, thoughts, feelings, behaviors, all connected.
The triangle, yeah.
We've unpacked the key principles, cognitive restructuring, challenging those thoughts.
Behavioral activation, getting moving.
Skill building, getting those tools.
And homework, the practice.
Right. And we've seen how it works in practice collaboratively, goal-oriented.
Yeah.
And learned about the really impressive range of issues it can help with.
That's a good summary. Fundamentally, CBT offers people a kind of practical toolkit.
A toolkit, I like that.
Yeah, a toolkit they can use to better understand and manage their own internal world, their thoughts, their feelings. And that can lead to really significant improvements in well-being and just a greater sense of being in control.
So for you, the listener, maybe as you go about your day-to-day, just take a moment. Reflect on maybe one area of your life where becoming a bit more aware of your automatic thought patterns, well, where that might offer a new perspective, or maybe create an opportunity for some positive change.
It's worth considering. Maybe even explore some of the resources out there on CBT.
You might just discover a really useful, empowering way to navigate your own inner world.